Hey everyone, Dr. Mike here. We all know how vital our blood is. It carries oxygen, fights infections, and so much more. But did you know that much of the magic happens in your bone marrow? That's right, it's the factory where blood cells are made. And just like any complex system, things can go wrong. Today we're going beyond the most well-known bone marrow disease, leukemia, and diving deep into 10 different conditions that can affect this vital organ. We'll break down each one, understand their causes, recognize the symptoms, and talk about treatment options. Remember, knowledge is power. The more we understand about these diseases, the better equipped we are to advocate for our health. So, let's get started. Let's start with leukemia, a type of blood cancer that begins in the bone marrow. It's characterized by the overproduction of abnormal white blood cells, which are crucial for our immune system. These abnormal cells, however, can't fight infection effectively and crowd out healthy blood cells. This can lead to a cascade of problems like frequent infections, anemia due to a shortage of red blood cells, and easy bruising or bleeding because of low platelet counts. Leukemia can be acute or chronic with varying levels of severity. Aplastic anemia is a serious condition where our bone marrow's production line hits a major snag. It's unable to produce enough red blood cells, white blood cells, and platelets, leading to a deficiency in all three. This can manifest as fatigue due to low red blood cell count, increased susceptibility to infections from a lack of white blood cells, and easy bleeding and bruising due to low platelet levels. It's like your body's defense system is understaffed and undersupplied. Myelodysplastic syndromes, or MDS, are a group of disorders where the bone marrow, our blood cell factory, isn't functioning properly. The blood cells produced might be defective or immature, and the body may not have enough of the cells it needs. This can lead to fatigue from anemia, frequent infections from low white blood cell count, and easy bruising or bleeding from a lack of platelets. MDS can sometimes progress to acute myeloid leukemia. Imagine your bone marrow, responsible for producing blood cells, being slowly replaced by scar tissue. That's essentially what happens in myelofibrosis. This scarring disrupts the normal production of blood cells, leading to a shortage. The symptoms can be quite varied, including fatigue and weakness from anemia and enlarged spleen, as it tries to compensate for the bone marrow and bone pain. It's a serious condition that requires careful management. Multiple myeloma is a cancer that affects a specific type of white blood cell, called plasma cells, which are an essential part of our immune system. These plasma cells are responsible for producing antibodies that fight infections. In multiple myeloma, cancerous plasma cells build up in the bone marrow, crowding out healthy cells and forming tumors. This can lead to bone pain, fractures, kidney problems, and a weakened immune system. Bone marrow failure syndromes are a group of rare disorders where the bone marrow fails to produce enough healthy blood cells. This group includes conditions like Fanconi anemia, dyskeratosis congenita, and Schwachman-Diamond syndrome. These syndromes often present in childhood and can lead to a range of symptoms, including physical abnormalities, developmental delays, and an increased risk of developing certain cancers. Polycythemia vera is a disorder where your bone marrow goes into overdrive, producing too many red blood cells. This overproduction thickens the blood, making it harder for it to flow smoothly throughout your body. Think of it like traffic congestion, but in your blood vessels. This can lead to serious complications like blood clots, stroke, or even heart attack. Platelets, those tiny cells responsible for blood clotting, are essential for wound healing. But in essential thrombocythemia, the bone marrow produces too many of them. This overproduction can lead to blood clots forming in your blood vessels. These clots can then block blood flow to vital organs, causing serious complications like stroke, heart attack, or even pregnancy loss. Chronic myelomonocytic leukemia, or CMML, is a bit of a hybrid. It shares characteristics of both chronic myelogenous leukemia, another type of blood cancer, and myelodysplastic syndromes, where blood cell production is faulty. This complex condition often affects older adults and can lead to an overproduction of a specific type of white blood cell called monocytes. While some people may experience few symptoms initially, CMML can progress over time. Hemophagocytic lymphohistiocytosis, or HLH, is a rare and serious condition where the immune system goes into overdrive. Instead of protecting the body, immune cells attack and destroy healthy blood cells. This can lead to a range of serious complications, including liver and spleen enlargement, organ damage, and even death. HLH can be inherited or triggered by infections, autoimmune disorders, or even cancer. So there you have it, a closer look at 10 bone marrow diseases that highlight the complexity and importance of this vital organ. From leukemia to HLH, these conditions can range in severity and presentation, but they all underscore the crucial role the bone marrow plays in keeping us healthy. Remember, knowledge is power. By understanding the signs and symptoms of these diseases, we can empower ourselves to seek medical attention promptly and advocate for our health. If you found this video informative, give it a thumbs up, share it with your friends and family, and don't forget to subscribe to my channel for more videos on health and wellness. Stay healthy, everyone.